Hello friends, Namaskar. Welcome to my new video where I would be demonstrating you the technique of application of a Bologna POP cast or the plaster of Paris cast. In our practice, we routinely need application of certain plasters, and Bologna plaster is such a common plaster which every physician should know so that he can apply it and gives handy results to the patients. So let us discuss the indications of applications of a Bologna plaster casting. If we broadly go through the indications of application of a Bologna plaster casting, definitely the ankle sprain is one of the indication, then fractures around the ankle joint, tendinitis such as cases of acute Achilles tendinitis, apophysitis like Sever's disease in children, and fractures of the tarsals and the metatarsals, or we can broadly say fractures around the foot. Now let us see what is the extent of a Bologna plaster. So whenever we are applying a Bologna plaster, the distal extent of the plaster is the metatarsophalangeal joint. So your plaster should start and support the metatarsophalangeal joint. If we see the upper extent of the plaster, it should incorporate the maximum bulk of the gastrocnemius and the soleus, or we can say calf muscles, and it should never reach the neck of the fibula, because here the common peroneal nerve is passing, and if we press it on with the plaster, then it can result in foot drop or other complications. So why learning the correct technique of Bologna plaster application is important, or any plaster? If we don't apply it in a correct way, then we can lead into certain disasters or complications. So I have just illustrated or mentioned few complications here. There can be plaster allergy in some patients, which can lead to redness, erythema and pruritus in the patients. If the plaster is too tight, it can even lead to compartment syndrome, which is a disaster and which one should never encounter in his practice. So he should be careful enough so that this complication doesn't happen. Then there can be pressure source if the plaster is too tight around the bony prominences, or if there is inadequate padding around the bony prominences. Then if the plaster is applied for a very longer duration of time, then it can lead to wasting of the calf muscles. So friends, before we proceed on to the procedure of applying Bologna plaster, let us see what are the inventories required. So we will need 6 inches ready-made plaster of Paris bandages, which are readily available in market. We will need a cotton stockinette. We will need a cast padding to enwrap the bony prominences, and definitely we will need a pair of surgical gloves to protect our hands, and we will need a bowl which contains water while application of plaster cast. So I would like to give an important tip that whenever you are applying plaster to any of the patient, use this plastic sheet which are easily available, and they will protect the soiling of the linen, and it would be very tidy. So the first step in applying a Bologna POP casting is to apply a stockinette on the limb. So as we know that the extent of the plaster cast is from the metatarsals, your metatarsophalangeal joint, to the maximum bulk of the calf muscles. So you have to take the stockinette slightly above the maximum bulk and slightly below and the metatarsophalangeal joint. The next step is to apply the cast padding. So you start at the foot and then you proceed proximally. So a simple trick is that whenever you are wrapping it, you have to cover the upper 2/3 of the previous wrap, and that is how you proceed. So you have to keep in mind that whenever you are applying a Bologna cast, you have to always check that your ankle is at 90 degrees to the leg. This position has to be maintained throughout the procedure. The next step is we have to take the ready-made plaster of Paris bandages in our hand. Always hold the edge of the POP bandage with your left hand and the roll with your right hand. Then you have to soak it in water, and you have to ensure that you have to keep it in water till the bubbles are coming out. Once the bubbles have stopped coming out, you take this and squeeze the ends of the plaster. Then again hold on to the edge of the plaster and move to the limb. So again we start applying from the foot, and we, in a smooth fashion, you have to apply it, going proximally, ensuring that you have to cover the 2/3 of the previous wrap while applying the next wrap. And you can use your left hand to remove the wrinkles and apply it in smooth fashion. Once your one roll is over, then you just smoothen it out, contour it to the anatomy of the leg and foot. So I am molding it here in the arch, then around the malleoli, around the lateral malleoli, around the tendo-Achilles and the heel, and then I just smoothen it out. Once it is smoothened, I go to my next bandage. So I have taken my second bandage and I am just wrapping it around, smoothing it out with my left hand. And now, as you can see, the ankle is going in plantar flexion. So before the plaster is set, I have to ensure that this plantar flexion doesn't stay in my plaster. So I just gently, using my palms, you don't have to press it with your fingers, just press it with your palm, again smoothen it out, and again mold it around the bony prominences. So I am molding it around the medial malleus, again along the lateral malleus, tendo-Achilles. The same procedure is repeated. So this is not adequate, yet we have to apply more POP. So I have taken the third POP roll and I am applying it gently, repeating the same thing which we have learned so far. And now I can see that I am about to reach the adequate cast dimensions which I need. So at this point you have to just hold the edge of the stockinette and pull it down. Similarly, at the metatarsophalangeal joint also, just hold it and pull it down so that all of your toes are exposed. So I am maintaining the 90 degree at the ankle joint and I have pulled down the stockinette. Now I just have to wrap the last POP bandage and I will get adequate strength which I need. So while applying this, I have to cover the margin of the stockinette which I have rolled back and do the final molding so that I attain the desired position and desired shape of the plaster which I need. So finally I just smoothen it out. Sometimes you will have lots and lots of excess POP, so you can just wash your hands with the water and again start the procedure. Continue smoothing it out with your hands. Don't press your fingers inside the plaster. The plaster shouldn't be too tight or too narrow, and definitely it shouldn't be loose also. So this is one thing which I cannot just teach you in one video. The adequate tightness of the plaster is one thing which you learn by experience. So once this, as you have achieved the desired strength of the plaster, you can what you can do is either you can take this cover of the POP bandage, or you can take the gloves also and you soak it in water, and yes, you can just smoothen out the plaster so that it looks good. So this is how it will become more shiny, more attractive. This is no relation to the functional outcome. This is just for beautification. It looks good. When the patient feels good and it looks like that some person who knows about the plaster technique has applied the plaster. So always use this. It will give you a sense of satisfaction. Ramesh ji, can you remove your hand? Okay. And just smoothen it out. Now let us allow the plaster to dry up. So our plaster has dried, and the beauty of plaster is this, that you can appreciate the contours of our anatomy through this plaster. That this is the arch, these are the malleoli, and this is the tendo-Achilles region. So whenever you are applying a plaster, molding is the most essential and important aspect of the plaster. And definitely remember that a Belloni plaster calf. One more tip which is essential is, don't leave the limb messy. You take some cotton, soak it with water and clean the limb. This cleaning is also important. Means you are applying a plaster, this is your responsibility to clean the limb. Don't just tell your juniors or some other person to clean it, because this cleaning will reveal the capillary filling also. Means you can just appreciate the capillary filling of the toes if the toes are clean. So clean them, clean the calf, the upper end, and definitely keep the things tidy. The take home message whenever you are applying a plaster is that you have to tell certain important precautions to the patient, which are always essential. That the limb has to be kept elevated on a pillow or two pillows. Patient has to do active movements of the toe, and if the patient thinks or feels that the plaster is tight, means he feels a constricting pain around the limb, and there is some swelling in the toes and or some color changes in the toes, then in that particular case he has to immediately rush to the hospital and the plaster has to be removed. Otherwise you can land up in disaster complications. So my dear young orthopods, I need to re-emphasize or re-mention that the precautions which need to be explained to the patients are extremely important, and you have to repeatedly remind the patient that he has to keep the limb elevated, he has to move his toes actively, and if he feels any tightness in the plaster, or if he thinks that there is some swelling in the toes and there is some color change in the toes, then he has to immediately rush to his doctor and if needed remove the plaster. So mitro, I am pretty sure that after seeing this video you will be able to apply a proper Belloni plaster to your patients, and you will not encounter the complications and will follow all the precautions and all the necessary prerequisites while applying this plaster, and definitely benefit your patients. So friends, like and share this video and subscribe to my channel so that I am motivated to make more such educational videos. Thank you.